Jaundice is a medical condition characterized by yellowing of the skin, eyes, and mucous membranes due to accumulation of bilirubin, a yellow pigment in the body. Bilirubin is a waste product formed when red blood cells break down. The major causes of increased levels of bilirubin are hepatitis, alcoholic liver disease, obstruction of the bile ducts, and hemolytic anemia. In hepatitis, inflammation of the liver often caused by viral infections like hepatitis A, B or C results in excessive bilirubin levels. Alcoholic liver disease, excessive alcohol consumption can lead to liver damage and impaired bilirubin processing. In obstruction of bile ducts, the flow of the bile which carries bilirubin may be obstructed by gallstones, tumors or other conditions leading to jaundice. In hemolytic anemia, increased breakdown of red blood cells can overwhelm the liver's ability to process bilirubin, resulting in jaundice. Now there are two types of bilirubin. Indirect bilirubin, also known as unconjugated bilirubin. This form is insoluble in water and is produced from hemoglobin from the breakdown of red blood cells, is converted into bilirubin in this spleen. Indirect bilirubin travels through the bloodstream bound to albumin and is taken up by the liver for further processing. It occurs normally in between 0.2 to 1.2 mg per deciliter. Then there is direct bilirubin, also known as conjugated bilirubin. After the liver takes up the indirect bilirubin, it conjugates or converts it into a water-soluble form called direct bilirubin. Conjugated bilirubin is then excreted into the bile and eventually eliminated from the body through the digestive system. And the normal range of direct bilirubin is 0 to 0.3 mg per deciliter. Here are some of the lab tests used in the diagnosis of jaundice. Bilirubin levels. A blood test is conducted to measure the levels of total, direct and indirect bilirubin. Then liver function test. These tests evaluate the overall function of the health of the liver and typically include the measurement of liver enzymes such as ALT, AST, ALP and gamma-glutamyl transferase. Abnormal levels of these enzymes may suggest liver damage or disease.